One of the questions that I get asked the most as a psychiatrist is, how do I find a good psychiatrist? Well, as somebody who has a 4.6 Google rating, which if you know anything about online reviews for psychiatrists means I must be the greatest psychiatrist in the world, you're going to want to stick around and watch and learn. When we're talking about the biggest predictor of success for a patient-doctor relationship, the biggest thing that helps is the goodness of fit. More so than the training of where the provider went to for colleges or degrees or certifications, any of that stuff, it's goodness of fit that's there. When we talk about the relationships that's there between the patient, the doctor, client, therapist, whatever we want to say, that bond, that relationship, that honesty, the trust that's there, that trumps everything else. During this discussion, we're going to be talking about an ideal setting where we have ability to make choices and pick and choose whoever it is that we want, that there are no kind of limitations per se. We have to understand that regardless of what the pandemic has done to our demands on mental health providers, that there was already a huge mental health provider shortage and a crisis that was there. At this time, we know that access is really limited. We have long wait lists for people. We have things that are other barriers to care as well, such as insurance, finances. All these things can impact who we can access, how fast we can access, where we can access care. The other really important kind of thing when we're looking to access care for ourselves, for our mental health, is understanding what is the appropriate level of care that we need. Who exactly do we need to see? One of the things I get asked a bunch is, what's the difference between a therapist and a psychologist and a psychiatrist? And there's often times where I'll be in session and I'll be called one version of all of these by the same patient. And it's kind of like, do you know what we're doing over here or do you not? So on a basic kind of level, and this is kind of very superficial in a way, a therapist or a counselor is equivalent in a way. They provide psychotherapy or counseling services, which is going to be what we call traditionally talk therapy. There are a lot of different degrees and or backgrounds which can lead someone to become a therapist or counselor. Some common degrees that we see are LPC, Licensed Professional Counselor, LCSW, Licensed Clinical Social Worker, LMFT, Licensed Marriage and Family Therapist. The most important thing when you're looking for somebody though, is you're looking for somebody who has a license, a licensure, or they're what we call a resident in counseling and they have supervision with somebody who is a licensed provider. That you can look them up and you can see what their registration numbers is so that they're beholden to some level of conduct and ethics and standards. Psychologists come in a couple of different forms. There's clinical psychologists and there's also testing psychologists. Testing psychologists will do things like psychological testing, testing for ADHD, testing for autism, testing for cognitive deficits. There's also clinical psychologists, which will do more therapy and or counseling as well. Those often comes with the degrees of a PsyD or a PhD. Lastly, we have psychiatrists, which have MDs or DO degrees. Psychiatrists are the ones that can provide medication. The training a psychiatrist goes through does involve parts of what therapists and or psychologists do. We may not be as involved as a psychiatrist in psychological testing, but we're trained to interpret and read those results as well. We definitely go through therapy training so people can say, oh, my psychiatrist is not somebody who I do therapy with, or there are people who will do therapy with their psychiatrists as well. But primarily psychiatrists are the people who provide medication. So depending again on what we need and what we're looking for, you want to make sure that if you're looking for just talk therapy and you don't want to do medication, you don't necessarily see the psychiatrist, and vice versa. Or if you're not sure, you come in through an entry point, one person along those way, and then you can kind of get triaged to whoever we need to go to. When we're looking then and we've decided about, hey, I need to see a therapist, I need to see a psychiatrist, what you're going to want to do is the research that's involved with that to find who's going to be that best fit for you. So what do we talk about? First thing is, primary care doctor, going to that person and then saying, hey, do you have referrals? Do you have people that you work with? You're basically looking for word of mouth. The word of mouth is always the biggest referral source, the most helpful referral source. Because if somebody's done well with them, they'll pass along that information and hopefully they'll be able to provide somebody else care. So you may talk to family, some friends, hey, do you know anybody that you know that's been helpful, that's good. Another thing is this, once you've decided to kind of touch base with somebody and say, hey, this is the person I want to work with, it's not uncommon to kind of reach out to them, get a little feeler for them. Maybe you can do a 15-minute call or video conference or meeting to kind of say, hey, are you somebody who I vibe with? Are you somebody that I could talk to, somebody I could feel comfortable with? Because we have to understand this relationship is going to be very intimate. It's going to be very personal. You're going to talk about stuff that you normally wouldn't talk to with other people. You can also kind of do some research online, read their website, read their blog, see if there's any social media stuff. I do a lot of the social media because I want people to get an idea of who I am as a person and who I am as a clinician. That gives them a little piece of me so that they know what I'm like already before kind of jumping in blindly and saying, who is this guy? And that's what you want to see. Do their views align with what I'm looking for? Is that all in alignment with my objective or my treatment goals are as a whole? When you're in that first session with them, what you want to have is you want to make sure that those conversations are two-way conversations, that it's not one person talking over another person. And it's more so you don't want it so that the provider is not the one who's talking over you, the patient or the client. You want to be able to feel heard. You want to feel that the decisions, the treatment goals, the treatment planning is done with you as a whole and that you're part of the team, that it's not somebody else who's deciding stuff for you. When I work with my patients, I always say, hey, I'm here. This is Team Joey, and I'm part of the team, and you're the captain of the team, and we're just here to help guide you and say, which way do we want treatment to go? The other thing that's really important in this relationship is you want honesty and feedback, and you want honesty and trust. You want to be able to feel comfortable enough to be able to say, hey, this isn't working for me. I need something different. These things that we've tried, these things that we've suggested, they haven't been helpful. Can we try something else? When we don't hear feedback that something is not working, my assumption is that whatever we're doing is working. So unless we're told otherwise, we're going to keep doing what we're doing. When things are being withheld for whatever reason, right? Whether we're uncomfortable with it, whether we just don't want to share it, that hurts the ability of the provider to help you out with the best way. Because we're working with what you're giving us. So if you're hiding stuff, if you're not telling us stuff, we can't give you the most effective feedback and or treatment plans or way to help you out. All right, well, I hope this stuff helped you out in regards to finding out how to find a person who's going to be able to help you out and what to kind of expect in a way your first meeting and what you're looking for and what's going to be a quote unquote a good relationship.